welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, and today we have with us the CEO of West Virginia Health Right, Ms. Angie Settle.
Yep, how are
Angie,
you today?
I'm doing great. And thank you so much for joining us here on Spotlight on Health.
I appreciate it. I appreciate you inviting me.
Yes, so today we want to talk about West Virginia Health Right, and in particular, the impact it has had on our community.
Wonderful.
So tell us a little history of West Virginia Health Right. When did it start?
So West Virginia Health Right started in 1982 by a group of volunteer physicians. Basically, like in the basement of a church, they noticed that there was a need in the community for unsheltered populations and just the need for people who were, impoverished to have access to health care. And it was basically, the old kind of school thing. You think about the doctor's bags, bringing their stuff with some samples, and basically just trying to treat people, where they were, and meet people where they were. And that's kind of how it started, just an effort of love. And it's just grown over the years, of course. I can tell you more about that. We've had, I think, 3 different locations. The one that we're in currently, we moved to I helped actually move on the weekend in 2000. So the current location at 1520 Washington Street East, we've been in for about 23 years.
And I see where you're doing a little expansion down there.
Yes, so talking about services that have expanded over the years, the services expanded. Of course, the base of West Virginia Health Right has always been our volunteers. We go back all the way from our inception. All the physicians that we have at West Virginia Health Right are volunteer. We don't hire physicians, don't hire dentists. They're all local physicians and specialists in the community that give of their time, come in maybe 2 or 3 hours, sometimes once a month, some twice a month, and they basically just donate their time to see people who don't have insurance. And then we also see patients with Medicaid, Medicare. Now, some of the physicians will see those in their office. Some don't. They would rather just see them at Health Right, so they'll see them as well. But that's the big, huge base of Health Right. How we're able to do what we do is that huge volunteer base. But that's continued throughout. But we've grown our services. It used to just be medical. Then it was medical, and we had a pharmacy. Then it was like medical and pharmacy and dental. And, I'm sure we're going to talk about that. But we've expanded the services a lot. I've been there
so
since.
Talking about the services, in addition to the medical and dental, a big part of what we hear about Health Right is the behavioral health services that you deliver to our community. And this is such a crucial area, especially given the amount of substance abuse that we've experienced here in West Virginia. Tell me a little bit more about those, kind of your outline of services.
Sure. So I've been at Health Right since 1997. I became the CEO in 2014. Previous to that, while I was there, any kind of behavioral health services that we needed, we would refer out to different local community partners, which was great that we had access, but you would end up with what I call a lot of bottlenecking. You would have patients that were more severe waiting in line behind patients that were less severe. We'd have people that would get off a bus that, maybe veterans or different people that had like 3 days worth of mental health medications, and then what are we going to do with them? You couldn't get them within 3 days, so a lot of times we'd have people in crisis. So one of the first things that I wanted to do was add behavioral health services, and what we did was we created an integrated behavioral health and primary care concept so that every patient that comes in from our primary care is screened for any kind of behavioral health issues, and we've since added, of course, substance use disorder issues since it's so prevalent in our community. But we have an overseeing psychiatrist, Dr. Dan Thistlewaite, who's a practicing psychiatrist here in our community. He's also since became a board member of mine, which is great. But he comes on site 1 full day a week. But in addition, we have a lot of mid-level providers, nurse practitioners. He's done a lot of additional training because as a family nurse practitioner, which is what I am from training, we do a lot of mild to moderate behavioral health conditions, but some of the more challenging things like bipolar, schizophrenia, things like that, we were not as familiar with. But by working with Dr. Thistlewaite and getting additional training and developing a relationship to him where he's available, all day, every day to my providers, we've been able to work together to where the nurse practitioners are comfortable treating, the mild to moderate cases. The more severe cases are where they're not sure, they consult with him a lot via telephone or, telehealth type situation. And then the more severe cases, he sees himself on site. The worst of the worst of the worst cases where maybe it's too intense for Health Right, those are referred out, but those are few and far between now. So what that has done has let us develop a program that's way more comprehensive. We're able to treat probably 98% of patients that present to us than we were before. And of course, tied with that is, substance use disorder care. We do a lot of that on site. We have a program with Vivitrol. For those people that need Suboxone or other type medications, our philosophy is whatever works for that person, works for that person. We're going to support that. Then we're going to refer out to people for Suboxone therapy. But we have recovery coaches and licensed professional counselors. And I have 2 nurse practitioners that are now trained that went back to get psychiatric nurse practitioner certification because they saw that as a huge need. Social worker, psychologist. So we've put a lot of the other parts in it, do group therapy and everything like that. So that's something that we've really built on.
It's clear from talking with you that you have a passion for West Virginia Health Right and for our community. When you first started at Health Right, tell me a little bit about, was it a job advertisement and you took a job there, or did you start as a volunteer?
No, actually I started, I did a rotation there when I went back for my master's as a family nurse practitioner, which would have been, 1995 or 1996, telling my age now. But things were really different there with training. We did a lot of things out in the field. We made sure that we were out in rural communities and got a very diverse experience. So I'm not really sure how I linked up with Health Right. I can't remember, but that was one of my rotations. And, the minute I hit the doors, I just fell in love with it. It was just like, wow. So it was during that rotation where I really found a love for it, and graduated in May of '97, but I actually started working there in March of '97 as an RN for a couple months. Then after I graduated, I transitioned into a family nurse practitioner role. Did that until about just seeing patients day in and day out until about 2006, and then I became the clinical coordinator. So I still saw patients, but I oversaw all the clinical work and scheduling and all that day-to-day stuff. And stayed in that role until the previous CEO, Pat White, who was the founder there, she was there 30-some years, decided she was going to retire and travel the world and enjoy life a little bit in her retirement, at which point then I kind of battled because I'd always been clinical, but I really loved the mission of Health Right and everything that we built and wanted to make sure we stayed true to it. So I just felt compelled at that time, and I was finishing my doctorate degree, and I had 5 kids under the age of 6 to throw my hat in the ring and apply for the CEO job. Not because I was dying to be the boss, I was just really committed to make sure that Health Right still stayed on the same continuum and projection, that we still were able to fill gaps in care, and that's kind of how it happened.
Yeah. And passion will do that to you, yes.
Absolutely.
Good, good.
Yeah.
And over the years, under your leadership as the CEO, you've definitely expanded some care and some non-care items that you provided the community. I visited both of the facilities that have kitchens and the community outreach to starting to teach healthier cooking, especially for those patients with diabetes and other health issues where diet is really important.
Critical.
And it's not something you find anywhere else. Do you know anybody else in the county that does that for us?
I don't think so. And I'll tell you, a lot of what we've done, we can go through all the stuff that we've added, which we'll talk about this first, but then we can go back and talk about mobile dental and mobile medical and all that. But a lot of the things that we've added were things that, when you have an opportunity to work at a place and you're there for so long and you get to know the population and the mission and everything, you really are able to identify gaps in care, things that you think you could do better. And one of the things that I always said was needed was, hands-on teaching people how to eat healthier and how to do the right thing. It's not enough to just sit in the exam room and say, well, you got to do this, you need to do that, you got to do this, you got to do that. So it was a lot of just the ideas that I had. So the first teaching kitchen was the one on the East End, and that happened around 2017 or 2018. And actually, it was the local Rotary Club approached me and said, we have a centennial project. We'd love to do something with Health Right, something bricks and mortar, a big campaign. Is there anything that you can think of that we could do? And we'd love to do something maybe that would impact heart health. And I was like, well, I have this great idea that I've been carrying around, making this list over all these years. I said, I've always wanted to have a teaching kitchen instead of having this health education room where we have, hot pads and we're telling people to write on the board, you need to cook this, you need to do that, you need this better. Or we'd actually involve the patients in it. Or they may be involved in the process of grocery shopping and learning how to budget and eat healthy on a lower income and, all the carbs and everything that's in it and do all that stuff. But then they would actually come up, be involved, learn how to, use fresh fruits and vegetables and herbs and things like that to make things tastier. But they would come out with something that tasted good but was good for them, and that they could actually take that home and reproduce that for their kids and their husbands and their wives. And, hopefully they would learn how to cook and maybe introduce new vegetables and things like that. So that was the concept. And when they came to me and I presented that, and they said, yeah, well, that's great. So we had a big square education room, just a plain room with some, whiteboards that we would write on, and we would teach in there. And we kind of turned it on its end, and with the help of BBL Cartland, who's been really great to do a lot of projects and donate some things to us along the way. But we were able to put a really nice kitchen in there. It was great. When we went shopping, we had one idea, and they had this great sale on this nicer stuff. So we were able to get nicer stuff and really present a really beautiful space for the patients. Now, that's not the one you're seeing there. That's the one on the west side. But the first one started on the east end. But when we learned from that one on the east end, which it's beautiful and it's still there, when we were able to go to the west side later and add the Community Wellness Center, we took everything that we learned about building that smaller kitchen and things we wanted to do different and try, where we actually were able to do individual cook stations so that each person had their own cooking station. That's what we did on the west side. Now, the east end, it's one big kitchen area where they gather. On the west side, they each have individual cook stations. Actually, in the remodel, we're going to try to go back to the east end and then do the individual cook stations, which we've learned is really better. But that's what you do over the years. You do your programs, you learn ways to make them better, and go back and try to. But both spaces have been great. A lot of weight loss classes and healthy heart classes, and cooking with diabetes and things like that. And so the patients are there. They may be waiting on medications in the pharmacy or something else. They're able to come in, see their provider, and then we piggyback off that, is what I call it. Then have a class, and they're there for that. So they're not just there for that one thing. They're able to maybe get 2 or 3 other nutrition classes, or healthy heart classes or exercise classes that we then try to package for them, so when they're there they get the full punch of health education and everything with it.
And that is so important because as a physician or any provider, there's only so much you can really do in an office visit. There's nothing like that hands-on learning that teaching kitchen provides, especially the one, when I visited the one on the West End, where each individual station, you have your own cooking materials there. That is such a great idea.
That was grants, people say, well, how do you do that? That was actually, that section was through a grant from Unicare, which is a managed care organization in West Virginia. And they donated $1 million to Health Right, and we used about $750,000 to $800,000 in that whole section, with the free gym and the free cooking space in the kitchen and all that. And then the other $200,000 actually bought a mobile medical unit that we use a lot of outreach for HIV testing and Hep C testing. So we've been blessed that people see the value in what we do, and we've been happy to get some additional funding. And I usually, as a CEO, if you get one-time funding, that's not something you get a bunch of additional staff, because we know on a tight budget, next year, how are you going to pay all those people? So what we did was we used a lot of that money and put it right back in the community with these free spaces and things that are going to add value. So so far, so good.
Oh yeah, no, it's definitely a big impact. So tell me about your new addition. What's your vision and plan for your new space?
So we've needed this space since, we've been planning it since 2019, even before the pandemic. During the pandemic, we gained about 10,000 patients.
Wow,
people,
that's a lot.
right?
You said gained.
Gained 10,000 patients.
On top of how many have you?
So we currently have 43,500 patients. When I took over as CEO in 2014, we had 15,000 patients. The way we've gained patients, despite the Affordable Care Act, because a lot of people said, oh, you know what, Affordable Care Act, if you have insurance, you don't need free clinics. What we've been able to do over the years successfully is find those gaps in care. So when one gap in care is filled, we see something else that I need, and we try to fill that. So that would be like the mobile dental program that we have that travels to 5 different counties of the state and rural counties, and we serve people in the remotest access areas of our state, like McDowell County, Logan, Boone, with free dental care. You know, the substance use disorder program that we did in response to the need in the community, those are newer programs that we've added, not to try to grow numbers, but because they were needed desperately. You know, the health education stuff that we've been doing in the Westside Community Wellness Center, that's contributed numbers, of course. But during the pandemic, you know, a lot of people financially were strapped, and people that previously were employed, you know, a lot of smaller businesses that closed were unemployed. So we gained 10,000 patients. We did a lot of community COVID testing. I don't know if you know, we were the number one testing site in the state of West Virginia. We did about 100,000 free COVID tests. And then, of course, vaccinations. We worked with Dr. Sherry Young, was your predecessor, and did a lot of community events with them, and a lot of the vaccinations and drive-through stuff. So, but patients learned about us that way. And there were people that didn't really know about Health Right that would come for testing. Previously, you know, a lot of people think about people that are, you know, unsheltered or all lower income, but there were people of all walks of life that would come through for testing because they were, you know, were trying to, you know, prevent outbreaks and everything like that. So there was a lot of people that were introduced to us that had not previously. But through that whole process, through, you know, medication needs and income loss, we gained about 10,000 patients. So somehow or other, between now and then, we now have 43,500. So, but in 2019, we saw the need that we weren't going to have enough space. It's about a 15,000 square foot building, the current building. But, you know, we had about 35 staff members when I started as CEO. And we now have about, I don't know, 78 or something. But, you know, so more space. When you're doing behavioral health, you have to have very HIPAA-protected areas. You have to have personal one-on-one counseling. So that's a huge part of the need. The current medical area, the whole medical area is going to transform into a behavioral health substance use disorder space in the new version of our building. And then all the new medical part will move into the new space. And then we're going to have expanded dental space, expanded vision space, health education space expanded. So it's a lot of treatment areas that will expand. And now, like my office and the grant writing team, we're going to move up to the 3rd floor of the new building. But and then the 2nd floor of the new building, we'll have some unfinished space for future growth, because we've used every nook and cranny of the current building. So it's taken a lot of years and fundraising and, you know, planning and all of that to get us where we were. And we had to buy the space next door to us, which took time, and work with the city and all of the zoning to try to get some space behind us and figure out additional parking, because every time you add additional space, you have to have so much parking. So it's been a very, very long process to get us where we are today. But we're currently under construction, and we have a set date for a ribbon cutting of June the 26th of 2024. So
excellent.
Very excited.
Time
to
flies.
Get there.
It'll be here before you know it.
Yes, it's been a big process.
So what you talked a minute ago about expanding the number of patients by 10,000 since 2019. Where have you seen the greatest need in our community that has driven so many patients to come to Health Right?
We have a lot of behavioral health needs. That is huge. You know, there were a lot of people who were managing or had maybe undiagnosed anxiety and depression prior to the COVID pandemic. For people that actually already had it, you know, when you think about it, and you think about even movies in Hollywood like COVID, the COVID pandemic was like the worst case scenario. You know, there's movies made like Contagion and different movies about having this huge outbreak and the shutdown of the world and all this stuff. And that actually came to fruition. I mean, I know you as a medical provider myself, it's like we never saw anything like it. So for people with anxiety and depression, that was that was really rough. And then when you take into it all the shutdowns and the isolation, and you had elderly people that were isolated, and people separated from their families, and people separated from their routines. And, a lot of times when people are left alone, a lot of time on their hands, your mind can really wander and worry. And I mean, just think about it. People with anxiety, worrying about, coming in contact, and we're having this mass testing and people in masks. And, it's just the worst case scenario for a lot of people. So there was a lot of people who that had to seek help for anxiety and depression. Of course, we're blessed that telehealth was introduced. Before we didn't do telehealth at HealthRight, but now we do. So we do telehealth for medical visits, behavioral health visits. So that's been great for our population, because a lot of them don't get time off from work, paid time off, or they have childcare issues or traveling issues, geographic, they don't have gas money. So this gives us an opportunity now to see people, on their cell phones or on their work break, or however they need to see us, and that's another access point. Also, some people are not always comfortable talking about their feelings or their behavioral health issues, face to face. And that protection of being behind a phone sometimes makes them a little more comfortable. So for all of these reasons, that's been a great thing. But the huge growth there in behavioral health. And of course, there were a lot of relapses with substance use disorder.
Yeah.
Again, a lot of people try to mask their pain with the use of substance use disorders. We won't go into all that about the reasons, but that also led to a lot of people either starting to use, or people that have previously successfully been in treatment and remission that had a relapse. So a lot of that was the growth there.
Yeah.
And then just basic people needing medications and medical help because they lost jobs and their income went down. And when your income comes down, one of the first things to go is your healthcare issues. People skip medications, try to stretch their insulin and all that kind of stuff.
What a blessing that HealthRight was able to step in and fill those needs in the community. And
Thank you.
Over the years, I've always heard about West Virginia HealthRight. I mainly practiced up in Jackson County, but how many people would come down to Kanawha County to be seen? Because you have 43,000 patients in a county of about 180,000 people. That means you're really reaching far beyond Kanawha County.
We do. We serve 34 counties, south central counties of the state.
34 counties.
34 counties we pull from. Some of them are from the mobile dental, of course, that goes out. You might have 2 counties that come for each of that, but that's true. We hate that people travel, but we offer free specialty services and the pharmacy and a lot of things, a free dental clinic that's open 5 days a week. So there are a lot of things that we offer that people can't get in different parts of the state. We're not the only HealthRight. There's other HealthRights that we all are. We each have different boards and setups and do different things, but united in the same mission to try to bring healthcare to the underserved. But we have a lot of access with their specialists and different programs that are very robust. And because of that, people will travel to come and get the care that they need. So that's how we're able to pull from the 34 different counties for what we do.
Yeah. There are wants and needs in this world, and it has really shown how much West Virginia HealthRight feels the needs of so many people that have no other outlet.
Wow.
Especially with dental and behavioral health. That is such a gap here in West Virginia. And I really appreciate what you do for our community because it is a true need.
Thank you. Well, like I said, it's the volunteers. We're kind of we have a paid base of like nurse practitioners, nurses, dental hygienists that are there to make sure when the volunteers leave that there's somebody there to get their labs and get all their x-rays back and follow through and make sure that there's no, that people aren't falling through the cracks. But it's that volunteer base that lets us do, I think it's for every $1 we get donated, we give $30 worth of care. And that's because there's a dollar value to every doctor, every dentist, everybody that volunteers there. They're given that care free with, in their private offices, they're billing insurance or, private pay or whatever. So that's what lets us really do what we do. And all the donors, like Charleston Area Medical Center, donates their lab services, their x-ray services, inpatient stays, all the surgeries that our specialists do. We have orthopedists, like Dr. Legg's going to be our volunteer of the year. We have a Volunteer of the Year celebration every year, and he's our Volunteer of the Year. He's an orthopedist, so he does these major orthopedic surgeries, gets the joint donated, and then CMC writes off the cost of the surgery, you know, the OR costs, the anesthesia, the x-rays, everything is written off. And you have somebody, you know, maybe that would have a career-ending injury or ailment, like maybe somebody that's a janitor that needs a knee replacement, you know, and think that's a career-ending thing if they don't have insurance. But now we have a volunteer in a hospital that's willing to give back. And because of our relationship with them, that, you know, that person gets a joint replacement, knee replacement, and they're back on the job, which is great for that person, for their pride, for their mental health state. But it's also great for the economy. You know, you keep people working and paying that tax base and all of that. So it's a win-win for everybody. But that's how we do what we do. If we didn't have all those volunteers and everything, we wouldn't, in all those donated services and grant funding and people that believe in what we do, we wouldn't be able to do what we do.
What volunteers do you need, and how do they volunteer?
So we have a variety of volunteers. Dentists, physicians, specialty doctors, lay people. I mean, even like helping with fundraisers or, you know, putting paperwork packets together. People that'll help with the teaching classes. People that'll chop vegetables. You know, we just have so many different ways people can volunteer. We have a big student base, like medical students and nursing students. I have people that have to have volunteer hours for high school, like Charleston Catholic, that'll come over and do stuff with us. So it's a variety of ways. I think you can, of course, you can always call the clinic and ask for us, 414, it's 304-414-5930 is the main number, and say, how can I volunteer? But on our
what was that number again? 304?
304-414-5930 is our main number.
5930.
But they have this thing called the web, www.wvhealthright.org, and if you search there, it'll have a volunteer section, and there's like a volunteer application we have you fill out just to get your background, you know, to know what you want to do and what you're qualified for. But anyway, like that, if people want to volunteer, you know, we'd love to have them. If it's 2 hours a month, if it's 1 day a week, whatever.
So you don't have to be a medical professional?
You do not.
Good
You do not. There's a lot of ways to volunteer. I have a board member, Fran, who's been with us forever, who actually went and got trained as a pharmacy technician so that she could work in the pharmacy, and she's there like once a week, one of our most valuable volunteers. There's so many ways to volunteer at Health Right. There's so much need there, so we welcome anybody that wants to volunteer.
Excellent. Well, Angie, I really want to thank you for joining us here on the show and telling us about Health Right.
Thank you.
And to our viewers, it doesn't matter if you're a medical professional or not, www.westvirginia, or that is wvhealthright.org. Jump online, take a look at their site, and sign up and be a volunteer. You don't have to be a health professional. You can do anything. Come down and help cook, help cut up vegetables and fruit.
That's right. Chop vegetables.
West Virginia Health Right, they're filling the needs of West Virginia. Thank you very much, Angie.
Thank you.
And we look
Thanks
forward
for
to
talking to me and listening about Health Right.
It's a pleasure. All right.
Thank you.